Yes, hi winners. So this is Dr. Srikanth from Team MDS Conquer. Now I'm here to give a brief idea of anatomy. Okay, so the task for the next few days is, first is general anatomy and followed by chemotherapy. Okay, chemotherapy of pharma. So first I'll be talking about anat. So anat, according to the NEET blueprint, is going to carry 14 marks, and if you come to AIMS and PGI, it has a decent importance. Okay, not as intensified as a NEET, but it has a very good decent importance. So how you have to handle anatomy? Okay, so anatomy, the books to be considered or the things to be done if you are a dental student. Okay, one is you need to follow the group, because group we are going to upload videos which were prepared from standard textbooks. Okay, that's the first thing what you need to do. And second thing is the PDFs that are shared on group. So all these are primary importance, and the evening discussions. Apart from this, you need to be perfect with dental pulse anatomy synopsis. So at the end of general anatomy subject of dental pulse, you have a decent synopsis of somewhere around 12 to 15 pages, okay, which is very, very important, covering all the memory based short things. So apart from this, I'm going to share a notes, okay, a smart notes that is prepared by one of our student long back, 3 years back, which has a very great importance in covering major aspects. But whatever it may be, whether it's a short notes or whether it's the synopsis from dental pulse or whether it is anything, make sure you add diagrams. Okay, so diagrams in the anatomy are important. So everything what you read, just try to correlate with a diagram, because they can ask a diagram based question. That is one important aspect, because if you see the recent NEET of 2020, there are more than 40 to 45 diagrams. Of course, in the AIMS also they have decent handy number of diagrams. So anatomy is a subject of favor to give few diagrams. So if you correlate your stuff, whatever you're reading, whether it's a PDF that is posted on the group, whether it's a notes that is being posted on the group, whether it's a dental pulse synopsis, make sure you try to coordinate with a beautiful diagram. That's what we are doing in the videos. So every day we are trying to upload few videos on general anatomy, which will definitely cover majority of the stuff related diagrams, which are important for you to retain for a longer duration of time. So these are the things that you have to do for anatomy. You have to follow for anatomy as an MDS Conquer student. Okay, I hope you are very clear about this part. So coming to the topics, the first one is, apart from the regular topics of general anatomy, which includes the regular topics, so there are 3 other topics that you have to do. Okay, so one is brain. Okay, brain is a part of your dental syllabus in general anatomy, which is not much stressed in the UG level. So brain is important. Both the physiology part of brain as well as the anatomical aspects of the brain are important. That has to be done. Apart from this, ear and eye has to be done. Regularly, the most commonly asked questions in the ear are about ossicles or about the tubes. And in the eye, the most commonly asked questions are either muscles related to the eye or nerves related to the eye. But it is mandatory that you have to learn all these brain, eye, ear with some more concern, because these are not properly covered in the regular syllabus of your regular MCQ books. Okay, so you have to keep a step forward and you have to give some more time for these things and try to retain the basics of brain, eye and ear. Okay, I hope you're clear about the topics. So apart from the general anatomy will also contain two other subjects. Okay, that is general histology and general embryology, which will be covered as a separate topics. Okay, which are not covered now, which will be covered as a separate topics once we are done with the anatomy. Okay, so total these three subjects are going to carry 14, but logically speaking anatomy exclusive will be 12 and your embryo and histology will be 1 plus 1. Okay, and most of your general histology, general embryology will be covered simultaneously with your oral histology. I hope you're clear. So coming to the topics and where you need to focus on these specific topics. The first important thing is about brain. So brain, a beautiful PDF of brain and spinal cord was posted. Few aspects of physiology were also included in the synopsis, and please do this PDF, that is more than sufficient. Okay, so we are done with brain and spinal cord. That's the topic one. The second topic is osteology. So for osteology we have posted a video. Along with the video, a beautiful notes that is prepared from Chaurasia, that is smart notes, and followed by your dental pulse synopsis and MCQs of this particular topic. That is more than sufficient. Once you're done with this evening, you can attend the discussion where everything is covered in a brief systemic way, followed by you can give your regular exam on the specific topic. Okay, so hope you're done, hope you're clear about the second day. The third day I have kept more topics, well known and familiar topics. One is thyroid gland, second one is mouth, third one is pharynx. Okay, so of this the most important thing is thyroid gland. Okay, so thyroid gland, you have to do the anatomy part of thyroid gland in your general surgery. So general surgery you have diseases of thyroid. So once, okay, so you can directly go to the synopsis part of general surgery where the anatomy of thyroid gland is covered for 1 to 2 pages. No need to go into the diseases aspect of thyroid, but go back to your general surgery synopsis of your dental pulse. Try to cover the basic anatomy of thyroid gland, which is given in 1.5 pages. So apart from that, the rest important aspects related to the thyroid, mouth, pharynx will be covered both as smart notes as well as the videos, and followed by the discussion and a beautiful examination. So in this you can include your dental pulse part and you can just try to finish the things which are there in the dental pulse. That is more than sufficient. Okay, so next, coming to the next one, that is topic number 4. Okay, the topic number 4 is larynx and the tongue. Okay, and coming to the larynx, the most important aspects in the larynx are the cartilages. So you have to learn about each and every cartilage, their shape and their function, their movement, and whatever that is required from the textbook. So you need a textbook reading for the cartilages of larynx, which has a high chance of a diagram based or a regular question. And the next one is coming to the tongue. Tongue, you need to cover both the developmental aspect of the tongue as well as the functional aspect, movement, as well as the muscles of the tongue, and preferably they are there in the synopsis, as well as I'm going to post some smart notes. They'll be covered here and there, but whenever it is required, coming to the movements of the tongue or the muscles of the tongue, I prefer you need to go back to the textbook and have a glance over it, because anyway we are going to cover them from our side, but I want you guys to go back to your textbook and just have a glance, and followed by you will have a decent video based discussion, and followed by an exam in the evening. So coming to the topic number 5, the topic number 5 is the vascular system. That is nothing but the blood system of head and neck. So blood system of the head and neck, I'll be posting a notes and some synopsis part of dental pulse are going to help. Just go with the synopsis followed by the MCQs and followed by the discussion and the examination. And next, come to the 6th topic. The 6th topic is going to be the muscles. Okay, the muscles of head and neck. The same sequence. Notes, video, pulse synopsis, pulse MCQs, followed by evening discussion and the examination. These are the levels how you need to handle this muscles. And the next comes is the nerve supply. Okay, the nerve supply is going to be the same sequence where the vascular supply, muscle supply, nerve supply. Try to follow the same sequence of your notes and videos, followed by pulse synopsis, followed by pulse MCQs, evening discussion, and followed by the examination. And the next comes is eye and ear. So eye and ear are basically not covered properly in any of the MCQ books. So I'm going to post a PDF over this, and please try to cover the PDF, and followed by the discussion, and followed by a small examination in the evening session. Okay, so apart from this, there are many other simple topics like ganglions, okay, salivary glands, lymph nodes, and many other things which are important in the examination point of view will be covered individually whenever it is required on the group, either in the video format or in the audio format, with a discussion. And the last and the least one to talk about is the clinical aspect. The clinical aspect of anatomy. Okay, the clinical aspect of anatomy will be covered in various other subjects like your general medicine or any other thing, but basically in the last day I'm just going to give a brief idea that how you have to focus on the clinical aspect of anatomy, and how you have to coordinate, like how you have to apply your clinical skills when a clinical aspect of a clinical based question is coming related to the general anatomy. But most often time I can consider general anatomy as a static subject. A static subject is a subject which doesn't change over a period of time, whereas coming to your dental materials or your prosthetics or your endo, every new day or every new year you come out with some new material and you come out with some new concepts, modification of this and that. Regularly this will not happen in your anatomy, okay, because anatomy is always the same. Whatever trigeminal nerve, whatever the branches you have is same as whatever I have, and whatever it's going to be after 10 years, the branches will be the same. There will be no modification in the branches. So similarly, most of your questions in your general anatomy will not change. Okay, the pattern of questioning or the way they ask the questions and the things will be the same. Means largest nerve is always the same, longest nerve is always the same, so there will be no modification. So my request for you guys is to just prepare a proper organized stuff. How you are organized on the day one is same as how you are going to read before the examination as a revision. So please do organize your stuff properly, arrange your stuff properly, so that the revision of anatomy is not going to take much time. Whatever we are doing from our side is, as a team, we are trying to organize the material and trying to make the things as easy as possible, whether it's in the notes or whether it's in the smart video or whether it is in the evening discussion. And whatever I am giving as an exam in the late night as a daily exam of 20 or 25 marks, I'm just trying to revise few things and trying to expose you for new things, trying to give an application based question. So this is what we are doing, okay, trying to improve your skills from all the directions, the possible direction, whether it's an application based question, whether it's a diagram based question, or whether it's a memory based question. Our goal is to make you strong from all the aspects, not only in a particular direction. The goal is to make you strong in all aspects, like to make you to get exposed to more number of MCQs, okay, so that you can be very familiar in the examination hall, like you can be very cool and you can handle the situation well. So that is about the anatomy. And coming to the last 2 to 3 days, my plan is to cover the chemotherapy. So chemotherapy is one of the part of pharmacology where we are going to split, and it's something like a divide and rule policy. Like you have to learn pharmacology by divide and rule policy, because if I'm giving 10 or 14 days for pharmacology and asking you to read, you will fed up with pharmacology, because pharmacology is a dry subject, and the second one is more memory based subject, because the drug names and everything are very typical. There is no concept except like pharmacokinetics and dynamics. which talk about the action of the drugs on the body and the metabolism, which are related more often to the physiology. They are concept oriented things. The rest all like remembering the classification, remembering the different generations of drugs, different subcategories of drugs, their complications, their adverse effects, their dosages, and is more often a memory based stuff. So when you come to a subject which is more often a memory based, like pharmacology in specific or something like biochemistry in detail, you have to split and read. You have to apply the policy of divide and rule. So that's what we are doing. So the first split and read topic of pharmacology is chemotherapy. So in chemotherapy you have many things, like the most common things are penicillins, you have tetracyclines, you have macrolides, you have aminoglycosides, you have many other, you have sulfonamides. Apart from this, you have antifungal drugs, you have antiviral drugs, you have anti-helminthic drugs or anti-parasitic drugs, and you have anti-cancer drugs. So there are many other things, and out of which definitely you know that the antibiotics or the antifungal agents or the antiviral, which are most commonly used in dentistry, is a most common area of question. Of course, my aspect is to read each and everything top to bottom, as we have 3 days allocated for this, and I want you guys to give your best to cover major topics. So our team goal is to make the stuff as simple as possible and will feed you in the best way. Okay, so your job is to just follow the things and try to work hard and try to practice more. So for this you need to go for Sparsh Gupta. There is no other move. Okay, you need to read Sparsh Gupta. Probably I'll let you know the pages and the things what you need to cover from Sparsh Gupta. So we will do this specifically from Sparsh Gupta. Once we are done with the Sparsh Gupta, like you will have multiple practices, like either an exam. If you want to take an exams on individual topics, you can take. That is one option you have. Or else if you want to directly solve your dental pulse, pharmacology part of chemotherapy of dental pulse can be easily solved if you are very familiar or strong over the subject with Sparsh. Okay, so this is about the plan of action for the upcoming 10 to 12 odd days, and I hope you guys were up to the frequency. Okay, still few people are trying to attain that frequency mark, but I feel like most of you are taking the thing seriously, working hard. I can see that positiveness in the offline classes as well as in the online sessions, in the doubt sessions, that you are asking the doubts or you are calling me, interacting. So they are very good positive signs that I'm able to appreciate from your side. And so these are all positive vibes that we are going to intensify our preparation, because we are approaching, because it's roughly we have 9 months from now for the examination and roughly 8 months for the November aims and 9 months for the December NEET. Okay, thank you all. Signing off, Dr. Srikanth from Team MDS Conquer. Take care, guys.